So most often what I'll ask the patients when they come in is, when is it worse? Is it in the morning when you wake up? Do you have trouble opening your mouth? Can you open one finger, two fingers, or can you open all the way? Do you have trouble biting sandwiches? Do you have sensitivity? Do you have biting sensitivity? I mean, all of those are major issues. Do you have headaches? Where in particular do you have headaches? There's a whole plexus of muscles. The temporomandibular joint is a very complex area. And so the actual bone issue is not a common occurrence, but it does happen. Most typically, patients have muscle spasm, and that's what they refer to, and that's why they have issues. So when you look at the temporomandibular joint area, there are many muscles which affect that. You have the jaw muscles in this area. When you bite down and you feel that bulge, those are the big chewing muscles which chew up your food. You have muscles up in this area which move your jaw forward and back. You have muscles which open and close. You have muscles that actually are around your head. And like a fan-shaped muscle. We're a very thin muscle, but that also is an important muscle. Muscles in the back of your neck. That's typically where people get headaches. Muscles which attach from below your ear all the way down to your clavicle or your collarbone. Anything like that can irritate, and when you palpate those muscles, if there's soreness, then typically they're in spasm. And the reason that people have pain with that is because muscles have nerves attached. And when a muscle, like your calf muscle, you get a cramp in that, what happens is the muscle gets inflamed. But more importantly, the muscle shortens. And so like your leg, typically in the jaw, if the muscle shortens or many muscles shorten because they're in spasm, then your jaw will sit differently. And then what happens is your teeth touch differently. And then you have all the issues of bite issues that occur because of that. So the purpose of treating a muscle spasm, treating stress and grinding, actually a patient is in charge of their own stress, but there are many things, especially since COVID. A lot of people are under a lot of stress between the different work issues, the different work modalities, all of those things that related to that. We still have a lot of residual from that as well. So typically what we do is one of the things that if a patient definitely is grinding teeth, also wear facets. That's another thing that we can notice on teeth by marking the bite and seeing exactly where they're hitting or where they're not hitting properly. The purpose of an occlusal guard, which I have one here, okay, and it's actually pretty neat because occlusal guards are not going to solve a patient's problem of grinding. But what they do, they're fabricated out of a rigid lab processed acrylic with a soft liner I use, and you can use either their upper or a lower one. But the important thing is that they're custom made. You don't buy them in the store and buy those squishy boil and bite things, okay, which typically don't help. Actually, they make grinding worse because they chew. So that's important. Those are great for football and soccer and all those other things, but they're not good for grinding. So, and when a patient comes back, the guard is inserted and is adjusted so that they're hitting point contact everywhere, so that there's no hills and valleys that you rub on your teeth. And then what happens is the jaw is allowed to actually float or skate. So the purpose is to keep the muscles relaxed, to reduce the inflammation in the muscles. And sometimes you have to go into things like, ibuprofens, typically naproxen. If someone has an acute situation, I'll put them on whether it's a leave over the counter or a prescription strength, depending upon the severity of the problem, for at least 2 weeks. That in combination with heat, 20 minutes per hour, and then a little bit softer diet. I mean, you don't want to be chewing gum, you don't want to be eating bagels, you don't want to be eating hard pizza crust because the muscles are sore, they're in spasm. So the purpose is to try and relax those muscles. I typically have patients who, wearing the guards isn't just for nighttime. If you're going to the gym, if you're running, if you're driving, the craziness out there today with the drivers out there, people are stressed. And so the more you can wear it, the better off you are, the better your muscles will be, the better your teeth are. If you know someone or live with someone who grinds their teeth or experiences pain when they wake up in the morning, please share this video with them. If you have any questions about this video, please ask in the comments. I'm there for you.